Thank you very much. And first, I'd like to thank the organizers for allowing us to present here today, and also welcome everyone to Seattle. LumiThera is just a 35-minute ferry ride across the Sound to Poulsbo, Washington. It's a beautiful opportunity to visit the Pacific Northwest this week, and we're excited to be presenting our data here today. So what I'd like to talk about is our 24-month final LightSight 3 clinical studies, results in dry age-related macular degeneration. And for those of you staying for the conference, Dr. Todd Schneiderman's presenting the study this week at the ASRS, and he won an award for one of the most top awards presentations for ASRS by the scientific committee. So stop by and look at the results as well this week. So the Valeda light delivery system is a mitochondrial approach to deliver light therapy using a multiple wavelength approach. It targets the retina with a little over 4-minute procedure per eye. We can treat both eyes, one after the other, and we typically do 9 treatments in a period of about 3 to 5 weeks. That stimulates mitochondrial function, and we see an improvement in best-corrected visual acuity, as we're going to show you in the clinical trials. The study here was done with 10 retinal centers across the United States. Some of the top retinal centers that you will see and your colleagues participated in the study. The study was 100 subjects, 148 qualified, 52 non-study eyes were followed for the course of 2 years. Study design was a double-masked, randomized, sham-controlled parallel group study to assess the safety and efficacy of photobiomodulation in dry age-related macular degeneration patients. These are intermediate patients, so the patients had to have some starting vision loss, mild to moderate vision impairment, 2032 to 2100. They were excluded if they had central GA involving the central 1 millimeter of their fovea, and the patients were randomized 2-to-1 from active versus sham. And the sham was the same treatment. We lowered the fluences over the 3 wavelengths, so it wasn't completely inactive. It's a low active control. Patients came in every 4 months for a round of sessions, and we followed them out to 24 months. 13 months was the pre-specified primary endpoint. About 70% of the patients were greater than 20/40 vision, and when you look at the primary endpoint, we met that at month 13, comparing in green the PBM versus the sham. What you see is after the first round of treatment, this is the modified intent to treat. You see an increase in BCVA letter change from baseline, and it continues over the second and third round of treatment, where we're seeing about a mean of about 6 letter gain over the course of the study. We see sustained benefits from month 13 all the way out to month 24. And what's important, we see 1 or 2 letter gain in the sham, but over the course of about 9 to 12 months, that is stabilized, and you start to see the 2 groups separate. And so by the primary endpoint was met with a p-value of 0.02, but at 24 months, you can see the delta between not only the PBM and the sham group is continuing to increase as the 2 groups separate. So look at that a little closer. When we look at the 13-month data, you see that there's a lot of the patients that are getting 5, 10 to 15 letter improvement in the PBM group in green, where there's more patients in the sham that are doing nothing or starting to show a few letter vision loss. But by 24 months, you see a bimodal effect. We're seeing sustained improvement with the PBM group, but more of the sham patients are continuing to progress and starting to lose vision. In fact, what we see is that after 13 months, about 5% of the PBM patients had lost more than 5 letters, or 7% in the sham, but as they're progressing in the GA in later stages, that increases in the sham group. We're at 21 and 24 months. We're now at 15 to 18% of the patients have lost greater than 5 letters, where only 5 to 7% in the PBM group are showing letter loss. So it's not only about letter loss, but letter gain with PBM. So we're seeing about, in the patients that completed the 2 years, about 67% of them are showing greater than 5 letter gain, with a mean in that responding group of about 9.1 letters. At 20% of the patients are showing at least 10 letters gain, and you can see that that's being sustained out for 24 months. So what about the pathology? When we look at central drusen volume, one of the key targets is the hallmark pathology of drusen. We know that can come and go, but it creates inflammatory nidus. And in all of our studies, including this one, we're seeing a reduction in the amount of drusen deposition. While these patients are early to intermediate, the drusen is less, but we're seeing at month 13 and month 21 about a 3 to 4-fold increase in drusen deposition in the sham versus the PBM, where it seems to be stabilized at minimal increases. We can see that on some of the specific images. This is a patient that maintained a 5-letter gain out to 24 months and saw a nice reduction in drusen over the central macula. But more importantly, and I think the kind of the bow on the package here, is we also looked over the course of 2 years the number of patients that are progressing to late-stage geographic atrophy. And what we saw with Glenn Jaffe and the Duke Imaging Center was a third-party masked imaging center that at 13 months, about 10% of the patients in the sham were progressing to later stage or category 4, only 1% of the PBM eyes, and now at month 24, we're seeing about 24% of the sham patients are progressing to later stage GA versus 67% in the PBM eyes. So in summary, we're seeing that the LightSight 3, again, extended the duration of treatments with PBM out to 2 years. We're seeing a nice improvement in BCVA that's extended out to the 24-month time point with a significant number of patients that are seeing 5, 10, and even 15 letter gains. More importantly, it's not just about letter gain, it's about preventing these patients from progressing further and losing vision. And what we're seeing is that more of the patients in the sham are progressing and losing vision. Overall, we're seeing the pathology mirror what we're seeing, and that less patients are showing drusen deposition, and less patients are progressing to late-stage geographic atrophy. So overall, the safety has been excellent through all the clinical trials, including LightSight 3. We're very excited to have this study done and be able to present it at the conference coming up tomorrow. Please stop by, and thank you very much for your attendance and allowing me to speak.